The World Health Organization announced the COVID-19 public health emergency will end at midnight on Thursday, May 11th, which brings some changes. Oregon healthcare workers will no longer be required to be vaccinated against COVID, but the requirement for educators will lift at the end of the school year on June 17th.
I think it'll help our students in school have consistent classroom instruction as they get through this next phase of our response to the pandemic.
Oregon is also lifting the 5-day recommendation for isolation if you get COVID. This includes the general public and K-12 schools. Oregon health officials say this is because of widespread immunity, meaning many COVID infections are now likely asymptomatic, and the 5-day isolation window is doing little to reduce transmission.
So we ask individuals that if they've been diagnosed with COVID-19 to, again, stay home while they're sick until they've started to recover. And in those 10 days after they got sick, to consider limiting their contact with others who are particularly at high risk.
OHA will no longer report COVID cases on a weekly basis, but will start tracking cases similar to the way they track flu cases.
We will continue to do wastewater sampling across many communities in Oregon. This allows us to detect COVID-19 spread in the community and the level of spread in the community, regardless of whether people seek care or get testing.
Despite all the changes, here are a few things that will carry on after May 11th. Oregon health plan providers will continue to give COVID vaccinations and treatments at no cost, offer free access to telehealth services, and a language interpreter during an office visit.
You know, all of us involved in this response can look back on things that, knowing what we know now, we may have changed. But I think we have to look at some of the critical outcomes and how we compare to other states and feel good about our overall response.
Now, Dr. Seidlanger says the age-adjusted death rate in Oregon was one of the lowest across the country. And OHA is crediting that to the policies and actions Oregonians and public health care professionals took the last 3 years. Brittany, Ashley.
All right, Daisy, thank you.